Good evening, everyone. My name is Darrell Arafat, consultant orthopedic surgeon. I'm in Uganda. I'm almost Uganda, so I can say Mulimotia. But I'm from Cuba. I came here to Uganda 3 years ago. I have to say thank you to this beautiful country and to thank you to Ruby Hospital also. So I joined Ruby Hospital in last year. I think last June. I have only 1 year working at Ruby Hospital. I've been working in some other places, but lately I'm based in Ruby Hospital. So I am witness how fast Ruby Hospital is growing in the field of technology. Before we had some equipments like a very good MRI, CT scan, etc. But lately we've been acquiring some cutting edges machines. One of them is our current neurophysiology department. In Uganda, we had many patients needing that kind of studies. We realized about that with certain patients suffering of mononeuropathies. We can say carpal tunnel syndrome, tarsal tunnel syndrome, and some spine conditions including radiculopathies. So we realized it wasn't available at all, that kind of powerful tool, we can say. And we decided to bring this kind of studies, neurophysiology studies. So as we can say, neurophysiology is a young medical field. It's a young medical specialty. Electroencephalogram, or EEG, was invented like the first one 100 years ago. So we can say it's not that old. So, but it's a very powerful tool for those who knows how to use it. So the EEG is one of the services we are offering now with a very wide kind of studies. As we can say, we can study epilepsy, sleep disorders, encephalopathies, psychiatric disorders, strokes, ADHD, COM status, and brain death. It's very important talking about the health condition for those patients can benefit. But it's also very important talking about the legal aspect in the patients. For those patients that are in ICU, they are connected to the respiratory machines, etc., spending time, and they have brain death, really. So with the EEG, we can easily diagnose what is going on with the patient, and we can assess properly the next step to take. So many specialties can benefit from those kind of machines, like neurology, orthopedics, and medicine and rehabilitation doctors. So electromyography is another kind of modality we have available nowadays in Ruby. It's very important for those patients suffering of neurological conditions, mainly myasthenia gravis and all of those conditions affecting their muscles. So that kind of test is very important for us. As orthopedics, we use it a lot in the radiculopathies. Also, we have evocate potential studies are very important for those somatosensorial disorders. So one of the specialties can benefit is the ENT and also neurologists. It's very important for those facial palsies and disorders of the peripheral nerves. Polysomnography is very important also to study the sleep disorders, and it's very important nowadays. The social media and the technology is giving a lot of sleep disorders. So nerve conduction study in my field is one of the most used studies. We as orthopedic surgeons, we have different challenges with different kind of patients. The mononeuropathies are very common, mainly in those patients whose work in office. They do professional activities with repetitive movements. As I at the beginning said, carpal tunnel syndrome, tarsal tunnel syndrome, Kerbein tenosynovitis. Those kind of affections are very related with professional activities. We call professional diseases. Also, the affections in the cervical spine cause radiculopathies. We can benefit with that kind of test. Also, our colleagues, neurologists, neurosurgeons, physicians, endocrinologists also can benefit. So the sympathetic skin response is very important because can take us through different kind of disorders, but is not very common in my specialty, but I'm very sure most of you they can use. So we are going to the intraoperatory monitoring. So the intraoperatory monitoring nowadays is a gold standard in the neurosurgical activity, in the neurosurgery. Also, us as doctors, are orthopedic doctors, we do spine surgeries, and we can use. Dr. Blessing, and maybe our colleague from India can go deeper in that topic. So, talking about economic impact. So nowadays we brought 2 high-end neurophysiology studies machines. So we have from the brand Nihon Koden, which is nowadays the most advanced type of neurophysiology machine, and we are offering that service at Ruby Hospital. We are benefiting of a wide range of studies they can offer. Talking about technology, I can say we have the latest technology at Ruby Hospital. So those machines, they have a very accurate and precise results, and our patients can benefit of those kind of tests.